Hi, everyone. Thanks so much for joining us. We are just going to wait another minute or two to let everybody get in, and then we will get started with our webinar. All right, we're going to go ahead and get started. Thanks so much for joining us on this Wednesday afternoon. This is our first webinar of the 2021-2022 series. Today, Dr. Ben Johnides is going to talk to us about how parents can help kids with anxiety. This is a new time for us, doing it at lunchtime. So I hope it's more convenient for you. It's a little more convenient for us, but then of course, lots of people are going to watch this after the fact, so it doesn't matter anyway. I am Mandi White-Ajmani. I am the owner of Small Brooklyn Psychology. We are a group psychology practice at Industry City in Brooklyn, where we offer therapy and neuropsychological assessment to people of all ages, all backgrounds, all psychological concerns. You can see our clinicians there at the bottom there on the screen. We have me, Natasha Brown, Jill DePietro, Sam Janite, Deidre Edwards, Nav Gill, Maddie Lawler, and then our newest additions to our team, Danielle DeFilippo and Ben Johnides. And so Ben is here with me today, and he's going to be leading this webinar. We all have experience in working with people across the lifespan, but we also have special training and experience to work with children and parents, including assessments and parent work for babies. And so, as I said, this is our first webinar in this year's monthly series. Recordings for all of our previous talks from last year, they're on our website at smallbrooklyn.com/services/talks. You can see everything there is, and it's all free of charge. The series is media sponsored by Park Slope Parents, which is a huge, very influential group in Brooklyn that provides so many resources to parents across New York City, but even across the country. I think that they've been a phenomenal resource for me personally, also for the practice, and also for so many parents that I know. So if you have not known about Park Slope Parents or are not a member, I would suggest you check it out. There's just so much advice, so much camaraderie, so much support, and so much learning like we have here in this webinar. And I want you to stay tuned for our next webinar, which is going to be on November 10th, where Maddie Lawler is going to talk about how to manage kids' behavior in a classroom or in a group. And this is a great talk for teachers or for any person that leads child groups, like a sports coach or a counselor. But it's also really great for parents when for example, like if your child has trouble in a group, like at class, you might be able to give some ideas to their teachers, for example. But also, we all experience our kids in a group, like at a birthday party, and sometimes it's just nice to have some ideas about what to do to help keep everything from getting completely out of control. So registration for that talk is going to be up in a couple of days. During this talk, if you have questions, I want you to type them to me in the Q&A box. In a minute, I'm going to turn it over to Ben, and he's going to lead the talk, but I'll be moderating the Q&A. So I will keep track of your questions, and then we will try and answer as many of those questions at the end as we can. And now to introduce Dr. Ben Johnides. He is a licensed clinical psychologist. He specializes in providing evidence-based treatment to children, adults, and families. His PhD in clinical psych is from University of Missouri, and he completed both his internship and his postdoctoral fellowship at the Center for Anxiety. Ben is trained extensively in exposure and response prevention for OCD and other kinds of anxiety. Also CBT, which is cognitive behavioral therapy, and DBT, which is dialectical behavior therapy. We use a lot of acronyms in this field. All helpful for symptoms of depression, anxiety, panic disorder, phobias, agoraphobia, suicidal ideation, school refusal, separation anxiety, social anxiety, health anxiety, anger management, and body-focused repetitive behaviors like hair pulling, scab picking, that sort of thing. In this work, he provides individual and family therapy for both neurotypical and neurodiverse clients. And he really incorporates parents and families into therapy anyway, but he's also additionally trained in parent and family focused treatments like multisystemic therapy and parent management training. Ben's also very interested in research on outcomes of clinical treatment, and that helps our methods to be as effective and efficient as possible. So I'm going to turn it over to Ben, and I'm going to make myself scarce, but I will come back in a little bit to do question answers.
All right. So we're going to talk about what parents can do to help their kiddos with anxiety. So first, let's talk about what is anxiety. So first and foremost, anxiety is not exclusively a bad emotion, right? It's not good or bad. It's a normal emotion that we all experience. Its function is to help us to respond to situations when there might be a threat, when we might be in danger, when we might need to perform a certain activity to survive, or we might need to help somebody in danger. Right, at certain levels, anxiety can actually be very helpful, right? When somebody is performing maybe a dance routine or in a sport, or when they're doing some other function that requires them to focus intensely on a specific set of tasks that they need to perform, there's a certain level when anxiety will actually increase performance. It's also a normal part of development. It's expected as an emotion that youth will experience. However, sometimes anxiety can get to a point when it becomes problematic. So there are a few things that we want to keep in mind when thinking about whether anxiety is becoming a problem or whether it's something that is pretty normal given the situation that somebody's going through. So we're going to think of, is this a developmentally appropriate level of anxiety? So let's say a kid who's 7 years old and is afraid to sleep alone at night in their own bed, and sometimes they'll sleep in their parents' bed. Right, we'll say that might not be ideal. It might not be what the parents prefer in that moment, right? But it's not that developmentally inappropriate, right? Now, if this kid is 17 years old and they're sleeping in their parents' bed, then we'd say this crosses the line of where it might now be more developmentally inappropriate. Also, is it proportionate to the true level of the threat, right? So somebody's afraid of dogs, right? What level of anxiety are they experiencing? What level of accommodation are they seeking? What level of reassurance are they seeking? How much are they changing their routines and their daily lives to avoid this perceived threat? And that leads me to the third point. Is it causing an impairment in functioning? Right? Is this causing the family to be late to certain functions? Is it causing the child to not seek out opportunities to spend time with their friends, to not participate in after-school activities, whether it's due to social anxiety, whether it's due to separation anxiety? These are all important factors that will help us determine whether anxiety is problematic or if this is something that is expected and normal that we don't really need to intervene with. So a little bit of background information on anxiety. Approximately 10 to 20% of youth will suffer from some form of anxiety. Right. Some of the more common types of anxiety include separation anxiety disorder, social anxiety disorder. Selective mutism is a little bit less common. Generalized anxiety disorder, specific phobia, and panic disorder. So what to do about anxiety if you realize or you think that this might be an issue for you or for your child, right? The top first line course of intervention is going to be cognitive behavioral therapy. This is well recognized as the gold standard treatment for youth anxiety. It's typically recommended before medication. So when talking about CBT, for anybody who's not familiar, I'm going to reference it as CBT going forward now. That stands for cognitive behavioral therapy. This is the cognitive triangle. So if we could boil down what is CBT into one brief slide, I think this would do a good job of helping you understand kind of the foundation of what CBT is all about. It's about recognizing the interaction between our thoughts, our feelings, and our behaviors. Now, when talking about feelings, right, we have emotions and physical sensations. So now we're working with a modified triangle. So how this might work is that, let's say somebody's preparing for a test. They might have the thought, oh no, I should have started studying 2 days ago, right? And now they're starting to feel nervous, right? Maybe there's a sense of dread. Maybe they're feeling anxiety now, right? Maybe they're having a catastrophic thought. I'm going to fail this test. I'm not going to be able to get into the college that I've been hoping to get into for the last few years, right? And now we're feeling physical sensations. Maybe there's chest tightness. Maybe we're feeling a dry mouth. Maybe there's sweating. Maybe there's a headache, right? And our behavior might be now that we're going to avoid studying for this test, right? Our catastrophic thought is that we're going to fail anyway, right? And we're too anxious right now to focus, so we're going to go do another activity, right? And this can then further influence our thoughts, feelings, behaviors, and physical sensations surrounding the situation. Why this is important to understand is that through CBT, we can intervene on the thought level to challenge negative thoughts or unhelpful thoughts that are causing us to feel intense emotions such as anxiety or depression, right? And changing these thoughts can change our feelings and our behaviors and physical sensations. We can also intervene on the emotional level, learning strategies to decrease the intensity of emotions and actually learning strategies to change the emotions that we're feeling. There are other strategies too that we can use to lessen the intensity of the physical sensations that we're experiencing. As we can help our bodies feel more relaxed, as we can slow down our breathing, we can actually decrease the intensity of some emotions that we're experiencing, which can allow us to slow down some of the thoughts we're having and to become more intentional about the behaviors that we choose to use going forward. Now, I want to highlight behaviors here. This is a really important part of treatment, especially when it comes to anxiety. Most evidence-based treatments for anxiety are going to include a heavy dose of exposure. So the way that exposure therapy works, right, is if we could take a step back and think about the distress that we're experiencing in a moment for a situation that causes us a lot of anxiety. So you can see here, we have time on the x-axis and distress on the y-axis. And as time goes on, let's say for the sake of example, there's a kiddo who was attacked by a dog and now has developed a fear of dogs. Now what happens is they're walking down the sidewalk and they're approaching a dog coming toward them. Their anxiety, their distress is increasing. It can only go so high. It's going to hit its peak anxiety, and then it will come down naturally on its own. Now, this is the part that might be challenging to get to, right? And when the distress gets to a certain level, right, we might start seeking reassurance from loved ones. We might start using safety behaviors, right? This could be maybe this kid is putting on loud headphones. Maybe we're putting on sunglasses. Maybe we're walking really, really slowly to the side, or maybe we're walking really quickly. Maybe there's a bus stop and we're going to go pretend like we're waiting to get on the bus so that we're kind of sheltered from the dog as it's going by. There are also accommodating behaviors, right? If we're walking with family or friends, we might say, hey, can we cross the street? I'd really like to look at these shops on the other side of the street. Or they might flat out say, I don't want to be walking near this dog right now. Right? And there could also be escape behaviors, which can be, I'm going to turn around and go the other way. I don't want to be anywhere near or in sight of this dog. So any of these things can happen here, which is going to serve the purpose of decreasing this distress over time, right? And this can become reinforcing in that now we're experiencing less anxiety. So we can look at this and say, did it work? Yeah. And sometimes our mind now takes the data point from this experience saying that, good thing I crossed the road or avoided that dog because of bad things might have happened, right? And now we're going to continue doing this. The problem with these behaviors is that they can validate the negative beliefs and fears that we experience over time. And what happens is this peak can actually increase, right? So it might not just maintain, it can increase this fear over time. And that's why it's really important to understand what are safety behaviors, reassurance seeking behaviors, accommodating behaviors, escape behaviors. What are things that we do to decrease this anxiety in the short term, right? And are these short term behaviors and strategies increasing the anxiety in the long term? So how exposure therapy works for anybody who's new to this topic, right? What we'll do is we'll have our first exposure, and we might start with an easier item, such as we're going to look at pictures of dogs. right? And as we're looking at the pictures of dogs, the first exposure, the first time we're doing this, the peak anxiety might be here. Maybe this is an 8 out of 10, right? And the second time we do this, it might be down to a 6 and then to a 5. And hypothetically, if we continued doing this to the 100th exposure, we would expect that the peak of the anxiety is much lower, and the amount of time that it takes to return to baseline will be much shorter as well. And we would continue this process working through more and more challenging situations over time. As we complete this for each situation, right, our anxiety for those subsequent situations that we might have initially rated as very, very difficult might now be of moderate difficulty as we start to generalize the learning that we're experiencing through doing these exposure tasks. So you might be wondering now, where do parents come into the picture? Right, so let's take a step back and think about, as a parent, that you're a natural extension of your child's emotion regulation system. Right, and so what that means is it's natural for you to comfort your child when they're in distress. However, over time, patterns can develop that can provide short-term relief and help your child cope with challenging emotions. What's important is to consider the function of these behaviors. So when your child was an infant, right, they might cry in distress when they're hungry. They might signal to you that something needs to change, right? And you will then kind of intervene and help them with what they need in that moment. You'll help soothe them, you'll help feed them, you'll help comfort them. And this is all natural, right? And I think for most parents, when you see your child in distress, right, your first reaction is to help them to feel more comfortable and to help problem solve in that moment. Right. And that is oftentimes a pretty normal, typical thing to do. However, when it gets to a point of these patterns, then now, instead of helping increase a child's level of functioning, these patterns are actually decreasing the child's level of functioning. In the long term, that's when it becomes an issue. Right. And this all starts because some of these things that we might do in the moment might be a good short-term solution, but through time, they might be validating that fear and the anxiety that the child's experiencing, which can then increase that issue over time. And we might find that now, instead of this one thing that we're doing to accommodate the child to help them get on with the day, whether it's to school or to be out with friends or to go to bed on their own, we might be participating in multiple rituals that are now required to help this child get to sleep. So it's important to think about, how can you find opportunities to allow your child to begin to build their own independent emotion regulation system while still being a supporting and loving caregiver. So first, what can be helpful to do is to recognize what is an accommodating behavior, right? And if you aren't familiar with what an accommodating behavior is, an important question to think about is, what changes have been made over time that provide short-term relief for symptoms of anxiety, but in the long term might perpetuate the fear through validating the negative beliefs? Right? This could be, for a kid who's afraid of dogs, what we might say to them is, don't worry, none of the dogs are going to bite you while you're outside, right? We're providing them that reassurance that this worst case outcome is not going to happen, right? And this is problematic because now we're validating the fear that this is something worth worrying about, right? This is something that we should be concerned with, right? When what's helpful in that situation is to say, Johnny, I know that this is really hard for you and that experience that you had was really challenging. I'm really confident that you can go outside and you'll be able to get through this tough situation, right? So other examples of accommodating behaviors can be answering repeated questions, right? It may sound at first that the child is seeking to gain information about something that's going to happen later, right? Maybe asking mom and dad, when are you going to be home tonight, right? Maybe they're going out on a date and the kid is really afraid to go to sleep on their own. So asking over and over and over, when are you going to be home tonight? What train route are you going to take? What time are you going to be leaving X, Y, and Z venue that you're going to? Right? It's important to take a step back and think about, are these questions really about them wanting to know where we are and what routine we're going, or what travel methods we're going to be using? Or is this out of fear that they're afraid we might not be home for them to go to sleep and they're worried that something bad might happen to us, right? So what we want to do is reduce those answers to those repeated questions and recognize this discussion as what it is. This child is expressing to you that they are feeling very anxious about this situation. Other accommodating behaviors can be sleeping near the child, performing checks. This might be checking whether there are monsters under the bed, something in the closet. This can be something like checking that the stove is off, that the doors are locked, or other routines that might be kind of built in to help the child decrease their anxiety and allow them to get to bed. Could be returning early from work. This could be driving, walking, traveling with special routines, or maintaining rigid schedules. So for anybody here, let me see if we have enough time to go through this. So this is a scale. If you're like me, you might like to have a number on the level of accommodation or whatever it is that you're measuring right now or talking about. So if you have the time, go through these and let's add up your score to see if accommodation might be an issue that you're struggling with at home. And for some of you, this might be zeros across the board. So I'll wait 1 minute and then we'll go on to the next slide. All right, and if you want to total up those scores, there's going to be another page of questions. So we'll spend another minute on this page. And so these are 3 categories. These are the second 2, modification and distress and consequences. Okay, so we'll be moving on now. And if anybody didn't have time to finish these questions, the scale is freely available online. You can Google family accommodation scale anxiety. It's by Leibowitz. And so now what I'd like you to do, if you did fill out and sum your scores, I want you to add up the participation and symptom-related behaviors. This is from the first page. And then that first section from the second page here. And you can see what your score is. The total is out of 36. The higher the number, the more accommodations you might be making for the child to help them with their anxiety. And then separately, you have your distress and consequences score here. So this can be a helpful indicator to know through time if what you're doing might be helping to decrease the accommodation over time. And this can then help your child learn to build their distress tolerance skills, helping them learn to tolerate uncertainty, which is a topic we might, if we have enough time, talk a little bit more about toward the end. So we'll continue on now here. So where to begin? We're talking about accommodation, right? So practical step that you can take if there's another caregiver in the situation. If not, then you can do this alone. The first step is to sit down and create a list of all the accommodating behaviors that you can think of. And then list the frequency. How often are you doing these behaviors to help your child cope with their anxiety? So there might be some that are 5 times a day, right? This could be um, checking the route to make sure that everything is kind of set in a way that is satisfying to the child. This could be checking whether the food is clean. Um, there are other accommodating behaviors that might happen once a day, or might even happen twice a week. The next step is to then choose which of these accommodating behaviors would have the most impact for you two or one, or if there are more than two caregivers as a group. And it's really important for this step that you're on the same page when you pick which accommodating behaviors you're going to reduce, right? With the idea being that if only one of you is reducing the accommodating behavior and the other one is picking up the slack and doing more of that accommodating behavior, we're likely not to see a change in the child's anxiety. What can also be helpful too is then to go to step 3 and create a hierarchy for how you're going to begin to approach reducing this behavior as caregivers. So your focus, to keep this in mind, is on changing your behavior. You're not trying to change the child's behavior here. We're just focusing on what can you do to help give your child opportunities to better learn to cope with anxiety, right? And this is a distressing experience for both you and your child. This is a short-term experience that's going to help them build their coping muscles to deal with anxiety for both this situation and also for future situations. So I think an example might be helpful here. So a lot of families can experience this over time where the child just simply won't fall asleep without mom or dad or another caregiver in the room with them. So we're going to target this accommodating behavior of being next to my child to help them fall asleep. So potential steps following the bedtime routine. So here our bedtime routine is we read for 20 minutes and we do that every night. So, and historically, maybe what we've done is we've laid with them in the bed until they've fallen asleep, right? And we get out of bed, maybe it was the nightlight that was on before, and we leave. But sometimes when we get out of the bed, they wake up and then we have to come back to the bed and they fall asleep again and we get up and we leave and then they wake up again. And so we're stuck doing this routine for some time. So maybe our first step is instead of lying in the bed, parent's going to sit up in the bed for 30 minutes each night. And when that 30 minutes is up, we're going to simply leave the room. Right? And the child might protest. And this is when you would provide them with a supportive statement. I know this is really challenging for you. I'm very confident, Johnny, that you can fall asleep on your own. Right? And from there, right, we're not going to be going back to doing that accommodating behavior. Right. And one thing to be mindful of when going through this process is that there is likely to be a strong child response to you changing your routines. Right. And you can recognize this as a manifestation of the anxiety, right? And the child attempting to get you to return to the accommodating behaviors that you were doing before, because for them, it was working. However, for the family, maybe it wasn't working. And I think maybe one of the most important things to keep in mind is that you're doing this for your child so that they can build this skill to do this independently, so that they don't need to rely on you to fall asleep. I mean, it can also be helpful of, what opportunities are they not having or seeking out now because of this fear, right? Are they avoiding sleepovers with friends, right? Whether at their house or going out to the other people's houses, right? Is this causing vacations to become difficult? And so I think really what's important to consider is that you're doing this for the sake of your child. You're not doing this to cause distress, although the distress is something that will be expected. And when you start, you'll likely experience some challenging behaviors that will be important for you to anticipate and to know that you're not going to be responding to these behaviors. Once you enact this plan, it's important to stick through it for both caregivers. You're going to follow through with week 2, then sitting in a chair right next to the bed for 25 minutes each night. Maybe then we'll sit in a chair 2 feet away from the bed for 20 minutes. The next week we'll sit in the chair in the doorway, still in sight for 15 minutes. Maybe the next week we stand in the doorway for 10 minutes each night. The idea here is that we can change the way that we respond to our child's anxiety. That gives them the opportunity to strengthen their ability to tolerate challenging emotions like anxiety. So what else is important? It's important to not tell your child that the worst case scenario will not occur. right? It's definitely true. It might be very, very, very unlikely, but it could still happen, right? Rather, what's important to do is to recognize that this is challenging, right? So we want to empathize, we want to validate, and we want to state that you're confident at the same time that they can get through this, right? So an example of a client, and this has all been changed, so it's de-identified. Um, Alex was a 12-year-old kiddo. He's afraid of being away from his mother, and each day he would ask his mother to promise that she would be home when he returns from school. This would help him then feel calm enough and ready to go to school, knowing that she would be there. And she would promise him every day that when he gets home, there's nothing that could get in the way. She will always be there. Right. This goes on for weeks until one morning when Alex's mother receives a phone call for a family emergency and she needs to go to the hospital. She arranges for the babysitter to be home to greet Alex. Now Alex is worried about his mother being away and at the same time angry that she broke her promise. So the problem is not just that the promise was broken, right? That's still an issue, right? Part of the issue is that Alex's mother is now validating that the worst case scenario is worth worrying about when she promises that it will not occur, right? And inadvertently, this is reinforcing the anxiety over time. So what we want to work on doing is providing a supportive statement once if needed, and we're not going to do it more than once. What we want to do is have the first part of the sentence focus on acceptance and validation, right? We're not getting to problem solving yet. What we want to do is focus on the child's experience, right? I see that this is hard for you. And then we want to express confidence that we think they can manage this situation. And maybe we can reflect on other situations that they've managed before that were really, really difficult as well. So we might finish that sentence by saying, and I'm 100% sure that you can handle it, right? So that is what makes a supportive statement. We want to avoid making statements that would be invalidating, right? So this can come up from time to time, right? Why can't you go to school on your own? Your sister is 2 years younger than you and she can do it, right? You should be able to do it, right? That's not going to help them feel less anxious, right? Now they're feeling anxious and they're feeling ashamed, right? Which is going to make it even more difficult to get any movement on the front of them going to school and building their confidence that it's something that they can manage. So instead, we want to again focus on what their experience is and also that we believe that they can do it, right? And then we want to proceed with the next step of whatever the family task is at hand and or remove ourselves from that situation. So an important thing to know when going through, if you are actually going to enact some of these steps together as a caregiving unit, you want to be consistent, not go back to performing the accommodating behavior, right? If you start to use this plan and your child escalates their behavior and then you start providing that accommodating behavior again, now what they're learning and taking away from that situation is that, before I only had to escalate to a level of 6 out of 10 to get my parents to give me what I need to get through this situation, right? And now what I've noticed is I need to escalate this situation to an 8 out of 10 for them to give me what I need, right? This phenomenon that you will experience when you start to change your routines is called an extinction burst. And this is something that will get better through time, and it might take a couple of days of escalated behavior with both caregivers remaining consistent before it starts to decrease. We want to look at all of the small successes through time. This is a process. This is not like a light switch that we can decide this is going to happen and we flip the switch and it's done. This is likely something that is going to take many weeks. And as part of that process, we want to make sure to give the child lots of feedback that we recognize the effort they're putting into the process. So the effort is the key. This process is the key. The outcomes will come. So if they're trying really hard and it hasn't happened yet, or maybe it's not happening every day that the way that we would like it to, that's okay. I would still focus on reinforcing that effort. That's what we want to have continue through time. We also want to make sure that as caregivers, whether it's one or multiple of us, that we can check the expectations that we have for our child in this moment, right? It will take time. It's important to provide that reinforcement throughout the process. And also as caregivers, it's important to provide that reinforcement to one another, right? If you're the one who the child prefers to be in that room each night, right, this might be more difficult for you to go through this process of reducing the amount of time that you're in the room with that child when they're asking for you to come back, right? This might bring on emotions for you that are tough to manage in that situation and might create an urge for you to then go back and comfort the child, right? This is an important time to loop in the other caregiver and for you to get support from them so that you can stick to the plan that you both come up with. And remind yourself of the goal, right? That we want to see this continued effort over time. The results are very likely to come, right? If we have a sound process, we're very likely to see good results. If you have questions about your process, you can always reach out to family, to friends. We'll have some recommendations at the end, and you can also reach out to other people you think who might have had similar experiences. The goal is to not experience zero anxiety, right? The goal that we're aiming for is to be able to complete an activity or a task without escaping, right? This anxiety is going to decrease on its own over time as long as we can begin to pull back on safety behaviors, right? So a safety behavior could be if I'm really afraid of becoming nauseated and throwing up. So maybe I have essential oils that I carry around with me. And whenever I feel nauseated, I smell these oils, right? So that's a safety behavior that over time we want to help the child pull back on. Accommodating behaviors, which we talked about for the last handful of slides, we want to pull back on those as well. And also the excessive reassurance, right? So the general rule of thumb is to think of each question the child asks, we can answer that one time, we can provide them with the information, and that's reasonable, right? But if they're asking a similar question over and over and over, this might be something that's unhelpful, and that's actually fueling the anxiety over time. So with these steps in place, this is something that you can do with changing your behavior to help the child build their muscles and coping with anxiety over time. So some people experience a situation where their child doesn't want to participate in therapy and they tried it before, right? So CBT is an individual treatment. It works very well with caregiver involvement. Sometimes kids are too anxious to come into the office, or they're just simply not interested in participating because what's happening right now is working for them. So there's a recent treatment that focuses specifically on what parents can do to change their behaviors to help their child with anxiety. And I want to be clear, this isn't saying that you caused your child's anxiety. What this treatment is doing is recognizing that this anxiety exists in a family environment, right? And as we change certain aspects of our family environment, that can affect others in the family. So as parents, when we start to change some of our behaviors, that can then create opportunities for our child to build skills that they'll need to cope with anxiety, right? And this treatment, it's called supportive parenting for anxious childhood emotions. SPACE doesn't require child involvement at all. It only requires caregiver involvement. The initial findings are very, very promising for SPACE and has similar treatment outcomes to cognitive behavioral therapy for child anxiety. So if you're looking for more support, important thing to keep in mind is that you want to look for evidence-based treatments. So these include some parent-based treatments for child anxiety and also some for disruptive problem behaviors. So SPACE is an up-and-coming treatment that's shown to be effective in reducing child anxiety through working with caregivers. There's also parent-child interaction therapy and parent management training, which are helpful in teaching parents effective strategies to reduce disruptive child behaviors in the home and in other contexts. Other evidence-based treatments for children include cognitive behavioral therapy, which you can do in an individual or a group format. There's also dialectical behavior therapy, which can be individual only. It can also be individual plus the skilled group. Other considerations. Keep in mind that in general, an evidence-based intervention for anxiety will focus on approach behaviors rather than avoidance, and it will have a strong emphasis on exposure to the things that worry the child or the caregiver if you're doing this individually for yourself, right? So these are some resources that you can all look to if you filled out that family accommodation scale and your score is greater than 0, if it's somewhere in the 18, 10 plus range, and it's something that you're interested in learning more about, and maybe you want to do this independently first, I recommend getting this book, Breaking Free of Child Anxiety and OCD. This is going to give you essentially a guide written for caregivers and families to how to implement this type of program. There's other reading here too, which can be helpful depending on what issues you might be interested in learning more about. And sometimes as adults, there are issues that we're also interested in working on as well. So for general self-help resources, I'd recommend checking out psychologytools.com and other evidence-based psychology resources, abct.org. And there's a Get Help tab there. It has a lot of fact sheets for different issues that can come up. And in general, the importance of evidence-based treatments, it's kind of akin to going to a doctor, right? For a medical procedure, you want to receive something that you know has been studied and is the best practice in the field. And it shouldn't be any different when it comes to a psychological intervention. You want to receive a treatment that you're paying good money for, that you're investing a lot of time in for your child to have the greatest chance of success through that intervention. And the best way to do that is to look up evidence-based treatments. We'd be happy to talk about that more anytime, whether you want to email us at hello@smallbrooklyn.com. If you want to email me individually, we're happy to help. So now maybe we can have some time for questions.
Awesome. Thanks so much, Ben. That was a great talk. And you are right on time. I'm going to have to quiz you about your time management skills because mine are not that good. So kudos to you. That was awesome. So we have had a few questions through the Q&A and I'm going to address them first. And then we also had some questions that people asked during the registration process. So I will try and get to as many of them as possible, but we're going to try and stay on time for this. So the first question has to do with how to evaluate the seriousness of the anxiety that is expressed. And that sort of came up in a couple of different places where I think people are worried about when to treat it seriously, when to assume, when to know, I guess, that it is something to go deeper in. So this specific question is about when a child complains or is over dramatic, how do you know when to understand that it's anxiety versus attention seeking?
Yeah, this is a tough question to evaluate without more context, but to know if it's anxiety versus attention seeking. So there is some overlap, right? When it's an anxiety related issue and they want reassurance about the situation, what's going to happen, right? And I think you can do an experiment as a parent to find out what the function of this behavior might be for the child. And when you meet with mental health professionals, you might hear them say this, that what is the function of the behavior? This is what we want to think about. And so if it's a disruptive behavior, right, we might want to think about what does the child have in mind that they want to happen in this moment, right? Is it that we took away the iPad and now they're really, really angry and they want the iPad back and they're becoming disruptive right now? Or is it something along the lines of they're starting to do their homework, right? And maybe math is a really challenging subject for them. And now they're starting to run around the house and they're flipping over the furniture and they're throwing things. Right? And this might look like a disruptive behavior, and it is disruptive, right? But this might be more of an issue that's rooted in anxiety, right? And so maybe one thing that could be helpful is to start tracking, when is this behavior happening, right? What's happening right before this disruptive behavior, right? And how have I been responding to this situation? And then maybe another column on a sheet of paper, is it working, right? What have I been doing that's reducing this behavior? What have I been doing, or what can I do that, has the opposite effect that increases this behavior? And what I would recommend is to look for patterns to try to identify if this might be anxiety or if this might be a disruptive behavior issue. Right, and at the end of the day, we might take a slightly different approach in how we're going to handle it. So I'll leave it there. I don't know if we want to go further into that question.
Well, I think this maybe bleeds into the extension of this, which is, at what point do you need professional help? Like, at what point do you decide that it's time to go see a therapist? Maybe to get help on the issue you were just talking about, so you can talk about it very specifically.
Yeah, I think this is a tough question in that therapy can take some time. It takes a lot of effort, right? And for a lot of child therapy, there's going to be parent involvement too. So this is a big decision. I think for me, if I were talking to a family member and they were sharing this information with me about when is it right to seek treatment, I would want to know, how long has this problem been happening, right? If it's been happening for 1 week, I don't think we're necessarily there yet that we need to seek an intervention, right? I think once it gets to a point of maybe we've been experiencing this for a month, it's not getting better, and in fact, it's getting worse, right? Then I would want to know what other changes have been happening potentially in the environment, right? Has there been a transition with school? Has there been a transition at home, right? Are we experiencing a pandemic, right? Are there other issues that are happening right now that are causing stress in the family, right? And that'll be an important thing to think about. But at the end of the day, I think one of the most important questions to think about is my child not able to do the things that are important for them to do developmentally right now because of their anxiety or because of these disruptive behaviors? Are they not able to go on play dates? Are we not able to go on family vacations because of these issues, right? Are they resistant to joining after school clubs that they're actually really interested in joining, but they feel too anxious to actually be part of that group? And I would say that's an important thing to receive treatment for, right? Not only is this something they're interested in, but this is preventing them from taking advantage of social opportunities to make friends, right? To build their social skills. And I would say these are the kinds of issues that are developmentally really important to kind of stay on top of. I would say not something that you need to think about every minute of every day. I don't want people to feel worried after me saying this, but these are important situations for a child to start building skills that are going to kind of be with them kind of as they go through their later school years.
Absolutely. Yeah, it's always really subjective, right? And it really comes down to, like you were saying, impairment. It's really, is it impairing a child's life in some sort, in some way? And you as a parent are the front row audience member of that, and being able to judge at what point is it actually causing impairment for your child or yourself. And, I will say that there's nothing wrong with reaching out to a therapist to talk it over too. Just because you talk to a therapist doesn't mean you're committing to 5 years of therapy. You can have an initial consultation, you can have a couple of sessions, and if together you decide that it's actually okay, then that's, now you've gotten your answer, but at least you have a chance to discuss it with somebody. All right. How do you know when a child with a history of anxiety and obsessive thinking is now diagnosable for OCD? Specifically, this person is wondering about like physical and auditory tics that might look like compulsive behaviors. Like, just generally speaking, what are some ways of knowing that this anxiety has now become an OCD process?
Yeah, so I think it's an important thing to think about when it comes to OCD is what are the compulsive behaviors that might be happening in this moment? And are they taking more than an hour a day? Right? Compulsions don't have to be strictly overt. There can be compulsions that are totally mental that people who aren't experiencing these intrusive thoughts aren't really witnessing. And for some people, it can be counting rituals in their mind. It might be certain things that they have to say in their mind. It might be other things that they're doing cognitively that other people aren't aware of. And so that's something that can be hard to assess for if you don't work a lot with OCD. I think, again, this loops in similarly to the last question of when is it worth seeking help, right? Treatment's going to look similar, whether we're working on anxiety or OCD, right? And the gold standard treatment for OCD is going to be exposure and response prevention. In terms of when it gets the label of OCD, I would want to know how much time are they spending each day on these rituals? How much is it interfering with their functioning at home? How much is it interfering with family, school, and peer domains? And then from there, you could determine whether they need a diagnosis of OCD. And I'm sure other questions will come up about diagnoses now, but I think for me as a therapist, the diagnosis is most important in informing what we're going to do about the symptoms that somebody's struggling with.
Understood. If anyone does have specific questions about diagnosis, I actually led a webinar on that last year called Mental Health 101. So feel free to go and watch that, and you'll learn all kinds of things about how we diagnose things. All right, so all of the things that you have talked about for reducing anxiety and things that parents can do to reduce anxiety, does it work for all kinds of anxiety? So I've gotten a lot of questions about like specific things. So for example, someone is interested in the anxiety that comes from being overwhelmed with sensory information. Other people were concerned about bedtime anxiety and fears of the dark. Do your tools work in all of those scenarios, or do you need to make specific accommodation, not accommodations, we're not doing accommodations, specific modifications for those things?
Yeah, so I think we want to say in the psychology field that there's one tool that works for everybody, but it's not true. And so I think part of an evidence-based treatment is that, right, it requires some flexibility on the part of the therapist and the family in creating a treatment plan that works for everybody. In general, the principles will hold true over time if what we're dealing with is truly anxiety, right? And that reducing our accommodating behaviors and learning to approach situations that make us fearful, right? We will be gathering learning, or we'll be gathering data points from each of those exposures that's going to help us learn to cope with and tolerate that uncertainty over time. So with regard to being afraid of the dark, right, this is a situation where reducing your accommodation is likely going to lead to a decrease in anxiety for the child. Caveat, not going to be easy, right? And it is something that will be effective if you can create a plan that is kind of easing the reduction in accommodating behaviors. So we don't want to list all the accommodating behaviors and stop all of them at once. That's going to be a really, really challenging time, and will probably lead to you then reinstituting some of those accommodating behaviors. And then that's going to teach the child that they need to escalate more next time you're not giving them what they need. In terms of sensory information leading to anxiety, I think that might be anxiety. It also might be a certain sensitivity threshold that somebody has to sensory information. And I wouldn't say necessarily that we need to kind of reduce our accommodations in that moment, as that might be a situation that for them, it might be really distressing and not due to anxiety. It might just be a very, very agitating situation. And if we apply exposure and response prevention to a situation where maybe somebody's getting agitated, or maybe it's a feeling of disgust, right? Now what we're doing, we're not treating anxiety, we're just causing a situation where they're feeling a lot of agitation and distress. So it's important to know before we go into an exposure protocol, kind of what is the core fear that we're working with? What are we targeting by doing these exposures?
Yeah.
We want to make sure that it's anxiety and not something that is unlikely to decrease over time, or that we're going to habituate to, like something that we're disgusted with.
Good point. So some of the other questions that I've been seeing have more to do with, are these tools things that you can use across the lifespan? So for example, one parent was asking about how Ellie Leibowitz's books have differences in child and adolescence. Like, does it really matter between the two different groups? Another parent asked about college age kids, that their daughter is a freshman now and has a lot of anxiety and OCD. Are these things that still equally apply across the lifespan?
I think for the most part, yes. And I think the reason why they would still apply is that these interventions are based on kind of the principles of what's happening within a family interaction. And it doesn't just have to happen with a kid. I think part of why their intervention might be so successful, and they're still doing moderator analyses to know why the treatment works and for whom it's going to work best. But for right now, right, thinking about the impact of your relationship with somebody, kind of, and how that relationship helps them cope with certain emotions, right? And this isn't limited to just a child. And the fact that you help somebody cope with emotions doesn't mean it's a bad thing, right? It just means you're a loving, caring family member or friend. And I think the question then becomes, you know, at what point are you helping them cope with emotions that aren't helpful in the long term? And so if it is somebody who's older, right, this is a tricky subject, because if it comes to somebody who's a similar age to you, you don't want to come across as patronizing and saying, I'm doing this to help you with your anxiety, right? I think that's less helpful. But maybe if it becomes a discussion, if somebody is receiving treatment and maybe you want to learn to be more supportive, you can ask them, like, what are some things that I can do that might help you in treatment? If you have a college age student who has OCD, right, you might speak with them, and if they're comfortable, they might fill out a release of information so that you could join a session or two to talk with the therapist about, you know, the holidays are coming up, they're coming back home, how can I support them with the work that they've been doing in reducing accommodations over the holidays, right? And they might be able to tell you without you joining a session. But I think getting involved can be helpful if that's something that they're willing to do. And I think it does apply over the lifespan. It just might look a little bit different with kind of what your accommodating behavior is look like.
So other questions have a little bit more to do with what does a parent do to help an anxiety, mostly in a younger child, when the anxious behavior is happening when the parent isn't there. So for example, there's a question about test taking anxiety and how they kind of practice breathing exercises and things like that, but the child forgets it in the moment. Also like social anxiety, kid is out at recess, having to navigate social situations. Parent isn't there to accommodate or not accommodate. How does a parent handle that?
Yeah, so I think an important part when you're not there to accommodate, which we don't want to accommodate totally in the first place, it can be helpful if we're helping them reach a higher level of functioning, right? Accommodating is not always bad, right? So it can be helpful if we're helping them learn how to manage that situation, right? And if we're there, if they're afraid of ordering in a restaurant, we're going to try to help walk them through those steps of learning how to do that. That's fine. In terms of not being present, I think one thing that can be helpful is to talk about the situation afterwards, right? And think about, is there any pressure for this child to make friends? Does it mean something really significant to them in that moment? Are there any, what I'm trying to say is, are there any catastrophic thoughts in that moment that are causing this anxiety for the child, right? If they're having any catastrophic thoughts in that moment, right? This test is really important. If I fail this test, I'm not going to be able to go to the high school that I want to. I'm not going to be able to go to the college that I want to go to. And then I'm going to have a mediocre job for the rest of my life, right? And maybe it's about they're afraid of disappointing mom and dad, right? And so I think part of that conversation is about kind of where is this anxiety coming from and how can we kind of restructure some of the thoughts that they're having, that it's okay if you fail this test, right? It's okay if you don't do a perfect job on this homework. And if we're doing exposures for perfectionism, that's something that you can work on with the child. And maybe this will make some of you afraid to hear this, but you can fill out some questions wrong on the homework and turn it in, right? And if you're really afraid of that, you can tell the teacher, like, hey, we're working on this with my child, and this is actually their homework as part of therapy. They're going to do a terrible job in this homework. I'm not going to let them know that you know this, but I want them to get X, Y, and Z grade, right? And that's part of the exposure for them to learn that it's okay if they're not getting 100% on all of their assignments. Of course, we don't want to do this if they're taking their SAT, for instance. I want you to get half the questions wrong. That's not what we're talking about. We're talking about a lower impact item where they can practice reducing perfectionism, right? And that's going to bring on distress. So I think to answer that question, I think it's back to finding moments to allow your child to express what's happening. And I'd encourage you to listen before problem solving for them. And this will then over time encourage them to bring more of these situations to you. And I think that's really where you can have a lot of impact as a parent, as you continue to build that relationship, that they trust you and they know that you're going to be there to support them through these difficult experiences. And that sometimes kids will ask for help when they need it. Other times they just want to complain about how terrible something was. And I think you want to make sure that they feel comfortable coming to you over time. And the way you can do that is by providing empathy and support.
Okay. We are nearly done, but we have just one more question. A lot of the reason that parents end up accommodating children's anxious behaviors in the first place is because it's really hard as parents to manage to sit with their distress. We don't like to see our kids in distress, and so we want to stop it as soon as possible. So how do parents manage their own reactions to a kid's distress in order to make it tolerable, to allow them to be distressed and thereby build up those muscles to tolerate it?
Yeah, I think this is something that doesn't get talked about nearly enough. When your child's doing exposure therapy, so are you, most of the time. And I think it's important to recognize it as such, that, right, you're a unit together, right? And as they're going through this change, you're going through it as well, right? And that maybe the child isn't the one who you're going to process that with exclusively, right? Maybe you can tell them this is hard, and at the same time, right, I'm going to help you learn how to manage this in the future, and that's why we're going to make these changes. Right. And I think is something that you talk about with the other caregiver, or if you're a single parent, then talk about with another family member or a close friend, somebody who's going to be accepting of what you're going through and not judgmental that, hey, why are you doing this now? You should have done this 5 years ago. This is why it's so hard.
How can you make your kid cry like that?
Exactly. And so I think finding a way for you to process these emotions, whether it's journaling afterwards, whether it's finding an online support group, there are lots of support groups, whether that's finding a short-term therapist who's going to help you make these changes, or in the moment, taking a breather. And before you go through with one of these plans, I would write down kind of what are some barriers that would get in the way of you continuing with executing this plan. Right. And as you can plan ahead, right, you might now have steps. Okay, when I feel this distress and I feel the urge to go into the room to help comfort them, what I'm going to do is I'm going to take a shower, or I'm going to go put on this TV show, or I'm going to call a friend for support and say, hey, this is happening right now. I just need you to talk with me while I get through this moment.
So you have those solutions ready to go for yourself, and you can turn to them easily without having to think it through in the moment when you are already cognitively, you have a heavy cognitive load because of your own distress and emotion. Awesome. Is that something that is addressed specifically in a SPACE program then? The parents' distress?
Yeah. So part of it is coming up with contingencies about, if X happens, then what, Y, X, Y, and Z. So if we're reducing the accommodations and right now we're not going to pick up our child from school, right? And then the natural question is, well, who's going to pick them up if I'm not picking them up from school, right? And so part of that is coming up with a plan. Is there a neighbor, someone you trust? Is there a babysitter, a nanny, another family member who can kind of bridge the gap between you reducing your accommodating behavior and your child building that skill to do it independently? And so there are a lot of contingency plans that you build throughout the way so that it's not just, I'm no longer picking you up from school, you're going to walk 10 miles to get home. So that's not what it's about. It's about finding ways of, or even think of it as successive approximation. We want to get closer and closer and closer over time. We don't have to get there all at once. We want to find a way to do it that's manageable for everyone.
Gradually, yeah.
Right.
Awesome. Sweet. Well, I know I have learned so much, so thank you very much. And I hope you all have too. So thanks again for joining us. Come again next month, November 10th. Maddie Lawler is going to talk to us about how to manage kids' behavior in a classroom or a group. I'm hoping to get those registration links up tomorrow. You will also get the slides and the recording for this webinar, and feel free to share it for anybody who might be interested. Reach out to Small Brooklyn Psychology for more help as needed. We are absolutely happy to help you, whether it's to set you up with one of our therapists or to connect you with somebody else who would be more appropriate. And thanks as always to Park Slope parents for helping us to get the word out about our series. See you next time.